Well, hello and welcome back to the Bedside Rebel, because nursing should not break you. Now, I've been highlighting some cases of nurses abuse, and I've never actually looked into it. We know that as nurses, you go in, you get yelled at. Patients are rude. Family members can be rude, and it's not to say that they all are, but we run into that so often that, and it's overlooked so often that, we just go in and we keep doing our job. But as I started looking into this, I started finding like so many. So I'm actually breaking these down in months, right? So I'm starting with January 2024. I'm going to go all the way up to now. And then, whatever I get done, so whatever I'm up to through this year, as far as we've gotten, and then I will start going back. But I'm going to do them month by month. I may not, forgive me, I may not capture all of the incidents as I do my research, but if you know of any others that have happened during that month, please drop a comment down below, because we want to recognize those nurses for their service, and we want people to see that this in itself is a pandemic. Nurses being abused. We have the lowest pay. We're the backbone of the healthcare system, and we have the lowest pay, with the executives making the most, up in the millions. And maybe even a billion. I don't know. I'll be doing research on that and posting that here also, because I want to capture all that information to make it very clear what we are talking about, and that make it clear that there are funds, and those funds are just not being allocated towards the backbone of the nursing or the healthcare system, and definitely not towards the safety of the healthcare workers, whether you're a nurse, a doctor, ancillary care. We all deserve to go to work in a safe environment. So, with no further ado, we're going to start with, I'm starting with January of 2024. Okay. Our first story is going to take us to Oldham, England. On January 11, 2024, a nurse in her 50s sustained serious injuries after being stabbed by a 37-year-old male patient in the emergency department of Royal Oldham Hospital. The suspect was arrested on suspicion of attempted murder. The nurse suffered life-changing injuries and continues to receive treatment. And like I said, I may not capture every incident, but you will see the number of incidents captured per month is noteworthy. It's overwhelming, and it highlights the need that something needs to be done about this. Okay, so next, between January 3rd and January 6th of 2024, a 59-year-old nurse was assaulted by a male patient at Prince of Wales Hospital in Sydney. And yes, this is not just in the United States. This is a pandemic. This is worldwide. This is an epidemic, really, of nurses that are being assaulted, and the money's not being allocated to protect them. But anyway, so the male patient, the perpetrator's name was Brendan Kavanagh. And yes, I will provide names as long as they can find them and they're publicly available. I will provide them. If not, they will be left out. So Brendan Kavanagh was arrested and charged with assault occasioning actual bodily harm and assaulting a frontline emergency worker. On January 29th, 2024, a female healthcare worker at Coffs Harbour Health Campus was violently attacked by a 21-year-old patient, Neo Wood. Wood allegedly assaulted both a nurse and another patient, causing significant injuries. He was charged with multiple offenses, including assault and causing actual bodily harm. You know, this is not just a smack on the ass. And that's assault in itself, right? When it's not, I don't know you, why are you smacking my ass? But this is to say the number of times that this is happening, and it's resulting in bodily harm, and nothing is done. So these incidents are highlighting the increasing dangers for healthcare work that healthcare workers face daily. You know, as nurses and healthcare workers, we dedicate our lives to saving others, yet our own safety remains at risk. Stand with our nurses, advocate for a safer workplace. And why? And why is that? Because nursing shouldn't break you. 1 in 5 healthcare workers is a nurse. Drop a comment, subscribe, support. Let me know if I've missed any incidents for January 2024. Share. Let's put these incidents on the forefront in one place and hope for something better. Hope for a better environment for our nurses. Because why again? Because nursing shouldn't break you. The Bedside Rebel is out.